It's a 21-day intensive, change your life, turn it around, look at yourself in the mirror, and say, whoa. Okay? And the reason I can say that is because I myself have worked with literally thousands of guests myself. So it's a very, very exciting place to be, to watch the transformation. It's tons of fun. You know, when you think about it, you're all here for your own reason. And I don't know what that reason is, but we all have choices. And what we know is that every single choice that we have leads to an outcome. We choose. We can be our own internal doctor, but do we really listen for ourselves? That's the question. And a lot of these, that's one of the things that we teach. So I'm going to ask you to kind of tackle yourself tonight and think about the choices that you're making. We're going to start tonight with Dr. Michael Badanek. I'm trying so hard to not pronounce his name so correctly. This gentleman has a ton of credentials and very, very powerful credentials. I have it. You're welcome to meet Nancy over here whenever you get a chance. He's here in town. But he does treatments like detoxifying. He's a clinical nutritionist. He uses applied anesthesiology. And he also uses energy medicine. So that's just 4 to start with. We also have Dr. Talmor here, and he's also an MD. And the reason that I've invited these gentlemen to share with you is because they also have some cutting-edge information to share. What we're going to be talking about with the 2 doctors before Dr. Clements starts is alternative therapies and how that impacts and affects immunology in the system. So we know at the Institute we're trying to partner, per se, with community. So we've invited the community to come just to share. And if you feel as though you would like to work with these doctors, you're certainly welcome to. We encourage you to come to the program. We also know that once you come to Hippocrates, transformation does occur, but you also need community support. So that could be through walk-through groups, through meet-up groups, in a wide variety of other ways. But we do believe in alternative types of therapy. Dr. Talmor tonight is going to be talking about the use of homeopathics versus pharmaceuticals. I myself made a choice many years ago. Okay, there was a point in my life when I went to the physician, and the physician didn't even know me because she didn't have time for me. She put me through to the nurse practitioner, and the nurse practitioner suggested that I take some antidepressants. From that time, my life changed. Okay, I wasn't depressed. Okay, there were some other things I needed to do, but not taking antidepressants. So Dr. Talmor is going to talk tonight about the use of homeopathics opposed to pharmaceuticals. Now, this is a medical doctor who's going to talk about, like I said, homeopathics and alternative types of therapies. And then we'll wrap it up tonight with our keynote speaker, Dr. Brian Clements from the Hippocrates Health Institute, who's a naturopathic doctor and has also a PhD. He's written several of these books here. He's scientifically analyzed all of these products here, and they're all whole food nutritional products. But also has a very, very strong foundation. So the medical students that are here. We also did an event last night, and that was in Orlando, and we invited Everglades University. And what I found out in Everglades University is that half of the students at Everglades are actually in alternative medicine. Okay? So we at the Institute don't say, don't go with allopathic. What we say is just consider your choices. Look at your choices within the world of the alternative therapies and see how that can support you. And I think that when you hear what I'm talking about now, considering alternative types of therapy, because believe it or not, an alternative type of therapy, you may think of yoga, for example, is alternative. But how alternative is it really? What we're doing is breathing. Okay? Think about it for a moment. What happens if somehow the oxygen stops in this room at this moment? Deeper breath sometimes is one of the key elements to recovery. Okay? But I'm not going to go through my further. We're going to hear from the doctor. Dr. Badanek, are you ready to share with us tonight for the power of us? I don't know. Are you guys ready to hear from the doctor?
I really don't know if I'm going to need this or not. And once I get wound up, I'll probably be dancing, like Dr. Clements wants us to do. My name is Dr. Badanek. I am a chiropractic physician. I practice in Mariontown, Cal, Florida. I've been here roughly 30 plus years. I think I'm in my 32nd or 33rd year. I do alternative complementary medicine. And during my tenure as a chiropractor, I have had the opportunity of getting a degree in medicine, board certification in naturopathic medicine, and also 4 additional board certifications in clinical nutrition, homeopathy. I'm also certified in applied kinesiology and such. So what my job is to treat what we call medical wreckage. By the time people come to me, they've been all around. I've got a lot of patients in the audience here tonight. And a lot of them have heard me speak, because I speak usually monthly in Ocala in the Marion County region on all different types of topics, from pathology to endocrinology to the immune system and so on and so forth. I want to thank Dr. Clements and also the Hippocrates Clinic for inviting me to come this evening. They want me to speak a little bit about how raw food has a direct correlation with your immune system. I don't know what Dr. Clements is going to say, and I don't know what Dr. Kelmore is going to say, so I'm going to try to say a few things a little differently that might just spur a little interest in what you have as far as healthcare is concerned. Okay. Can you hear? Is this as good as the mic or not? I really don't need this. Do I need this? Normally, I don't do slides. It just comes right from the gut, so to speak. And so, let's talk about alternative medicine. First of all, how many here are students at college? Raise your hands. How many here are in the healing arts going to school here? Anybody in the healing arts at all? Okay, very good. Now, if we take a look today in alternative medicine, we say that you are what you eat, breathe, and drink, and what you're exposed to. That's classic. Okay? If you have a disease state, most of the time that disease state takes anywhere from about 10 to 30 years to come about, because everything's at a cellular level. As the cell is changing, in time, enough cells form a group to cause a tissue change, then finally an organ change and an organ system change. And by the time you get to organ and organ system changes, that's when you start having clinical symptoms and you go and see your primary physician, your doctor. In many cases, you're given a prescription. And you have to know really how medicine works. It has 2 major functions. It blocks an enzymatic reaction to occur, or stops it, or blocks a receptor site. Now, in many cases, that has nothing to do with the cause and effect of the particular situation. I believe that most disease is either due to a nutritional deficiency and or a toxic reaction to the body, either an exposure to something, such as if you have mercury fillings in your mouth, or a root canal, or a bridge, or any metal in your mouth, which can expose you to things such as cadmium, mercury, and so on and so forth, which is then depressive to the immune system. That's important. So what we try to do is we try to go back and to try to differentiate and diagnose by alternative means, by functional medicine and also traditional medicine, to find what the problem is. And then from that point, we address the issue as far as the problem, and then we treat it. Now, what the Hippocrates Clinic is one of the best places I've ever met in my life to send patients to. Because the biggest problem I have with patients is compliance. You know? You start on a program and they come in to see 4 to 6 weeks later, and how you doing? Well, I'm doing terrific. Well, how come you haven't stopped something, you know? And they don't see the results. So you follow up with laboratory tests and studies and so on and so forth. And 9 times out of 10, nothing materializes. So the Hippocrates Clinic is a godsend to have people that are really, really sick go to, and to then, at that juncture of time, be trained as to really the basic fundamentals. Because, see, I can sit here until this time next week, nonstop, 24 hours a day, talking to you about alternative medicine, and still not really cover the whole gamut. So, in the brief period of time I have to speak to you folks, I want to cover one thing, which is critically important. Has anyone ever heard of a gentleman by the name of Fritz Alfred Popp? Fritz Alfred Popp. Anybody? Okay. Have you read any of his work?
No.
Okay. Well, in 1996, Fritz Alfred Popp changed the paradigm of medicine. Because you see,
Up until 1996, with him and his researchers, we thought in medicine that everything was biochemical and reaction in nature. Now we know we have roughly 50 to 100 trillion cells in our body, and each one of those cells has an excess of 100,000 enzymatic reactions that occur every minute of the day. That's a lot of stuff going on, isn't it? A lot of stuff. But here's the thing. If we dealt with biochemical reactions, we could never get done fast enough, and we wouldn't even be here now. We'd be gone. So what Fritz Albert Popp did with his researchers, he developed and researched and proved without a shadow of a doubt that life is light. Energy is derived from light. And what I mean by that is this. We know that light travels at 186,000 miles per second. Pretty fast stuff. Sound, 640 miles per second. Okay? So how does this work? Well, we know that if you have organic food and we have conventional food, we know that the organic food is better than the conventional food. With light spectroscopy, we can determine this now. See, because here's what happens. If you take an organic carrot, and you take a conventionally grown carrot, and you measure them with light spectroscopy, the carrot that's organic is much brighter light. So how does that have anything to do with the human body? It's simple. Each of our cells has DNA. And this DNA flexes and extends like an accordion. Okay? And as this DNA flexes in, it takes in light from the outside, such as an organic carrot. Nutrients, water, whatever. And if that light is coming in the form of a biophoton, it goes into the DNA. The DNA then extends out. The light then comes out in a bright light, which then goes to the powerhouse of the cell to produce enzymatic reactions in life, which is called the mitochondria. Each cell has 11,000 mitochondria. And so in essence, it's what you eat and what you consume determines the brighter the light coming in, the more energy that you produce to feed the body. So if you eat a McDonald's burger, very dull light, you know? Dull light coming in produces dull light coming out, which then the body does not respond as quickly, premature aging, setting you up for degenerative changes, pathology, endocrine conditions, and so on and so forth. So it all boils down to, they found out what life is all about. Life is light. Okay? So, we can take any of these fine nutrients here, and we can analyze them. And as we analyze all those beautiful nutrients, and we took them in, that bright light would then go to your DNA. You would then produce your own biophotons going to the mitochondria, producing energy, and there you are. That's life. That's life. If you have an opportunity, read on him. Fritz Albert Popp, P-O-P-P. He should have won at least a half a dozen Nobel Peace Prizes. But this is sort of suppressed stuff. See? So what I try to tell people is that you are what you eat, breathe, and drink. And hopefully, when you take in good, you'll produce good, and then you'll live a longer, more healthy, and productive life. And so that's interesting. That's pretty much what I have to say on this matter. I've got a short period of time to say it. I don't know where I'm at, Carol. Carol, I still got some time, or am I running shy? Or?
You're doing good. 10 minutes.
Okay. So when we're dealing with this stuff, it's critically important. Now, I can go into tangents in all the different fields of endocrinology and pathology and autoimmune conditions and so on and so forth. But I'll just cover just one little thing here. Anybody here on statin drugs? Medication?